Welcome to my channel. These are the important questions which I just tried to cover in case of dental anatomy, and some of them were in the real ADAT exam. So you can have the look at the question and then you can try to attempt the answer, and then I will give the explanation and you can make the notes for your final preparation, and you can use this when preparing for your ADAT and apply your knowledge and concept during your final day. So let's start with the first question. Testolingual twist of the lateral incisal edge, which is absent on the central incisor. So this is a very distinguished feature we can use when we are differentiating mandibular, central and lateral incisor. So this one is the correct answer is C. From the occlusal view, the major feature distinguishing mandibular lateral incisor from the mandibular central incisor is presence of the distolingual twist found on the distal half of the lateral incisor edge. The distolingual twist follow the natural arch shape. Just like the shape of the mandible, there is a twist. So we can differentiate it. And in the mandibular central incisor, on the other hand, is bilateral symmetrical with the centered cingulum. So one more question is like arising from here, like the cingulum. In the mandibular central incisor, cingulum is in the center. It is not offset from the center. So you can make the note of this explanation, and it can be tested in the final ADAT. Let's move to second question. The curve is formed. Exception. The curve is formed by lingual inclination of mandibular molar. No, that's the curve of Wilson, not the curve of Spree. So remember this point. And there's the explanation. So if you guys want to take the screenshot, then you can take screenshots also and read the explanation. Let's move to third question. So, the mucocinator muscle is not supplied by trigeminal nerve. Assist in mastication. It's just in the cheek, so help us to put the teeth in holding the food under the teeth. And it originates from pterygomandibular raphe and maxillary mandibular mandibular buccal-alveolar process. So this one. All other muscles are innervated by trigeminal nerve and V3, that is the mandibular nerve. See. So the answer is primary mandibular second molar. So primary is mandibular second, but it resembles the permanent mandibular first molar. So this one is the explanation. Then let's option fifth. The primary teeth erupt in which of the following sequence? For this thing, always remember a first central incisor erupt, then lateral, then molar, then canine, and then second molar. So the sequence will be A, then we have B, then we have D, then C and E. I just received this question in my final ADAT exam, so you have to remember it by heart, whether a erupting sequence for primary or permanent, and which tooth will replace which one is succedaneous, non-succedaneous. Very important. Then we have sixth question. A patient represented your office with what appear to have 5 mandibular incisors. So first thing I would say, we have 4 incisors, so one is extra. However, upon radiographic examination, you count 4 roots. So roots are 4, one teeth is extra, right? So most explanation of this is, for this one you need to see, okay, this one differentiate fusion or germination. So fusion, one teeth is missing, but here it is one extra. So it is germination. Remember all this definition by heart. Like basically the people get confused between concrescence and hypercementosis. So hypercementosis is extra deposition of the cementum, whereas concrescence is the joining, the tooth join at cementum level. And in fusion, there is one teeth missing, whereas in germination there is a split. So it can split can go to the center also, but there are 4 roots, the teeth will be extra. And then we have fibrous displacement. See, the answer is D. So double teeth, although both feel like they are double teeth or like, but we have to remember which one the teeth are missing and in which one the when we calculate the teeth they're extra. Then we have angle classification of occlusion. It is very important. They will give you the pictures of the patient and will ask what is the angle of classification for this patient. If we move to mesially, distally like this, how it will change. And even in primary, flush terminal changes to which, distal step to which. So remember this. The first thing is the basis of the angle classification. So the basis is the relationship between the angle classification occlusal is based primarily on the which one? Relationship between the, it's not the anterior teeth, it is not the position of the maxillary canine, it is not amount of anterior overjet between the max and mandibular first molar. So if it fall into the maxillary first molar, it fall into the mesiobuccal groove of the mandibular first molar, it is class 1. And if it the first molar, the maxillary move mesial to this position, it is class 2. If distal, it is class 3. Remember by heart. It will move to anterior, then downward and medially. That is mandibular first molar. The both the mesial contractor marginal ridge is more cervical than the distal, which is a unique feature of the mandibular first premolar. Distal triangular fossa of mandibular first premolar. So the correct answer is B. Tilt mesially and therefore will articulate with the distal triangular fossa mandible premolar counterpart. And one thing we have to remember, mandibular teeth are situated mesially and lingually to the counterpart in maxilla. Therefore, as a general rule, maxillary tooth will articulate with this counterpart and the tooth distal tooth. Likewise, a mandibular tooth will articulate with this maxillary counterpart and the tooth mesial to it. So first premolar will occlude with the mandibular first premolar, that is its counterpart, and mandibular second premolar to distal to the counterpart. This C. Mesolingual cusp of maxillary first molar. This fifth geminal nerve. The auriculotemporal nerve conducts the primary innervation to TMJ. So it is from the branch of cranial nerve B3, that is the mandibular. So it provides the sensory fibers to the TMJ. So remember by which posterior tooth is most symmetrical from the occlusal view. Let's see the option: maxillary first premolar, maxillary second premolar, maxillary first, mandibular first premolar, and mandibular first molar. So the answer is mandibular second premolar because it has a oval occlusal outline, so making it more symmetrical than the first molar, which is asymmetric, which has hexagonal shape. So remember this. Which tooth is most likely to have two canals in a single root? So mandibular canine, no. Mandibular second premolar, no. No. So remember, only the maxillary first premolar have two roots. It's one tooth is first, but it has two roots. Whereas the maxillary second premolar, it has like the tooth number is two, but it has one root. And in mandibular lateral incisor, there is chances that we can have two canals. Two canals, sorry. In the maxillary first molar, a depression associated with the furcation might be detectable on all of the following surfaces except. Very tricky question. So let's see. Answer is palatal because the large palatal roots span the entire width of the lingual surface, tapering from the CAJ to the blunted and the rounded apex. So just remember, on the palatal surface, no furcation can be detected.